I think it's true. I think when we do things that are local, we usually have less help than in the operating room, which is just like a more formal setting. So there's more people around.
One of the interesting things is in terms of deep plane facelift, they are all in.
I can't believe I was doing that at a local. I mean, it worked, but I just felt like sometimes it was a little bit variable, like how comfortable you get patients.
I think it's because both societies are sort of frenemies.
The beauty scientists, Dr. Kristy Hamilton and Dr. Roy Kim. Real beauty without the hype.
Welcome back. I'm Dr. Kristy Hamilton, board certified plastic surgeon, here with my fellow board certified plastic surgeon, Dr. Roy Kim, and together we are the beauty scientists. And we have an exciting episode today. We're talking about Dr. Kim's recent meetup at one of the facial plastic surgery meetings, and that's always interesting to see colleagues. They're not the same as board certified plastic surgeons or board certified facial plastic surgeons, and learn about what they're talking about. So why did you decide to go to this meeting? What was kind of piquing your interest?
I was actually invited. So one of my good friends, Dr. K, K Dure Raj, is a facial plastic surgeon. And so she invited me to talk about some stuff. And this is the very first facial plastic surgery meeting I've ever been to. So it was a lot of fun.
That sounds wonderful. And I'm not surprised that they invited you. You've got so many innovative ideas and beautiful results. So why do you think it was the first time you've gone to a facial plastics meeting? I've never been to one either.
Yeah, I think it's because both societies are sort of frenemies. So in other words, for those out there who really don't know the rivalry, we're plastic surgeons, Dr. Hamilton and I. So in other words, the traditional way of doing it is learning about general surgery, which is ICU care, intestines, trauma care, all that stuff, and then going into plastic surgery. And that is by far the most common way to go. There is a different way. So specifically, you can major or do training after med school in ENT/otolaryngology, and then do additional training in facial plastic surgery. So their training is very focused on the face and head and neck. And so essentially it's like head and neck cancer and hearing and ears, as well as cosmetic stuff of the neck and the face. They specialize in it. And there has been a rivalry for 100 plus years. But to be honest, most ENT/otorhinolaryngology surgeons don't go into aesthetic facial plastics. Only a subgroup do. So throwing all that aside, I mean, if you're a good surgeon, you're a good surgeon. But this is why they don't really go to our conferences a lot, and we don't go to their conferences a lot. So it was a big honor to actually speak with them, meet some people who I've never met but follow on social media.
And can I ask, so what were you talking about? What did they invite you to speak on?
So the two things I talked about were practical ways to use AI in aesthetic surgery, and also how to melt calcium hydroxyapatite, also known as CAHA or Radius.
Yes, so you've helped me with that before. So for the viewers out there, so Radius biostimulator, when placed appropriately, it's great. It can be used to augment jaw lines. It can also be injected more dilutely as a biostimulator for collagen induction, make your skin glowy. But a side effect can be these nodules. So how do you go about treating patients who may develop those?
Yeah, so essentially from the dermatology literature, you can actually melt calcium deposits. And so the dermatology skin condition is called calcinosis. It occurs in lots of different people, certain skin conditions or medical conditions. So they have a chemical, it says STS, sodium thiosulfate, which actually helps with calcinosis with dermatology patients. And since calcium hydroxyapatite is a form of calcium, it actually works. Now, there are some little tricks or tweaks or hacks involved with it, and it doesn't melt as quickly as when we melt HA, hyaluronic acid, with hyaluronidase. It's not that rapid. So, but it does work. And especially in patients who really have a difficult nodule and the normal way of diluting it doesn't seem to help, melting it does work.
Amazing. And I know we should probably do a follow-up episode all on AI, because you are the guru of always bringing technology to plastic surgery and the practice and the actual practice of medicine. But what were the overarching takeaways from the whole meeting, from the lectures you attended?
So they do the same things that we do. However, having said that, one of the interesting things is in terms of deep plane facelift, they are all in. I'd say 80, 90, maybe higher than 90% of the facial plastic surgeons are doing deep plane. I do think in our field of plastic surgery, it's not 80 or 90%. I'd say we're still discussing it a lot, maybe 20 to 40%,
Mm-hmm.
because really they're all in. So that was very interesting. The other thing that they do is that they're sort of all in on the deep neck lift, where they're pretty
Mm-hmm.
aggressive about removing the structures underneath the platysmal muscle, the neck muscle here. More of them are doing more of that.
Okay.
And then I did learn a couple tweaks, which were very interesting as well. Of course, we can do endoscopic brow lift. So, in other words, you make tiny incisions in the scalp. You have a curved camera where you can see everything and dissect everything under here and really lift it up. I saw a facial plastic surgeon who uses all the equipment but doesn't use a camera. And so he's able to safely and quickly elevate the eyebrow a moderate amount, but not like as much as you can visualizing everything. But having said that, a lot of patients only need a moderate amount. You save so much time. You can do it very safely. You're not like damaging anything. I've never really thought about that, but that was actually very cool. And I think the biggest thing that I saw was there's a plastic surgeon, not even facial plastics. He was invited to talk because he does deep plane facelifts under local anesthesia. So
Amazing. What
yes.
were his?
I think the biggest thing was you still need patients who are, yes, they get a lot of local anesthesia before the beginning of the case, and they also still get oral sedation. He actually
Mm,
has 2 scrub techs. So typically when you do things under local, it might be the surgeon by themselves, or it might be the
right.
surgeon with 1 assistant. He actually has 2 assistants. So it's not for monitoring or anything like that. It's much more about like positioning the patient, his body position, what he's looking at, who's holding what, and he feels that that actually delivers a better result.
It makes it easier for him.
Yeah.
So yeah, I think it's true. I think when we do things that are local, we usually have less help than in the operating room, which is like a more formal setting. So there's more people around. Really, really interesting. I did, especially during the pandemic, I was doing a lot of things under local, and I've kind of like I was doing everything under local, like things that like now I'm like I can't believe I was doing that under local. I mean, it worked, but I just felt like sometimes it was a little bit variable, like how comfortable you get patients. Like some people would just be like sleeping, and other people like really you just seem to not be able to get them as comfortable as you would like. And so it was like that variability. I liked being the same every single time. So
Yeah.
I went away from that. But I did some of my facelifts under local, and the patients would just like sleep the whole time. It's just you just wouldn't know. What was new in the world of skincare or improving skin integrity?
Yeah, I think the biggest thing, I have not seen this yet, but I'm sure we'll see it at our next meeting. They have something known as PDGF kits. So, of course, we already know that we can get your blood and spin it to get PRP, platelet rich plasma. They have a kit that now makes PDGF, platelet derived growth factor. So, that,
Mm,
as you know from the nerdy medical school science we learned, is that it helps with wound healing. They have now created a kit for the aesthetic world. So you can now apply PRP and PDGF, and they're 2 totally separate components from from your blood. And you can actually have accelerated healing if you apply both. So that was pretty cool.
that's exciting. So are they using that for like lasers and microneedling, or is it something that they're applying to like incisions after surgery, or both?
Both. So in other words, facelift, neck lift, when you're done, you inject some, you spray it around topically, it works. You can also use it for topical things as you just mentioned. Laser resurfacing, microneedling, you can use it for those procedures and it also helps. So at that point, the patient they don't need that much blood, yeah, as you know, but they do need to give a little more blood than maybe would be readily accepted. So patients, I think, obviously you need to have a decent blood count. They can't be anemic. And one hint they had was that make sure your patient's hydrated if possible before you draw their blood. If they're going general anesthesia, you actually want to draw their blood by giving them IV bolus and then draw their blood. That seems to help.
Okay, interesting. I like that. Um, Especially when we know how these growth factors work, so that's like very exciting to have. Um, and then the next question always that people are thinking about, they always come in, they want to know what can I do that's going to get something close to a surgical result without doing anything really invasive. And of course, we don't have anything that's going to deliver a full aggressive surgical result. But was there anything that was kind of piqued your interest or seemed exciting?
Not at all. So, I mean, and I'm not saying this in like a negative, grumpy way at all. Rather, the facial plastic surgeons, they're real doctors, they're real surgeons. There's nothing that they're doing. There's no technique. There's no technology they're hiding from us that really gets that non-surgical result when you really want a more, like even a moderate surgical result. In other words, there's nothing like throwing everything in the kitchen sink, less invasive, non-invasive, lasers, RF microneedling, PDGF, PRP. I could go on and on and on. There's nothing that they're doing. There's nothing that they're hiding from us where they get great results, phenomenal, almost surgical facelift results. There's just not.
So every year I feel like there's certain patients that ask me, like, is there in fact anything new? And I'm just like, not to replace the facelift we've been talking about and so putting off until we're waiting for technology to improve. And then I know you and I both love exosomes and think those are like similarly, like with some of these other kind of topicals or blood draws, like exosomes are another way to improve skin quality. But I know that they got into like a little bit of heat in terms of how people were applying those. So we know like topical application, okay by the FDA, injections, maybe not, kind of under debate. But were there any updates on exosomes or their?
I think the only update is potentially political. So without politics, yes, they could probably generate some type of kit where we can get our own exosomes. We could, we could definitely send our blood, like your blood, my blood, to a lab and then get exosomes derived from it. But again, that sort of technology is very expensive, as well as you're not supposed to inject exosomes yet. So one interesting thing is that they did mention that Robert Kennedy Jr., this is before the election. Now we're recording this after the election. He's going to be involved in the Trump administration regarding healthcare. And Robert Kennedy Jr. has been very adamant about health, chemicals and foods. He actually wants aggressive use in public health of psychedelics, peptides, stem cells, raw milk, hyperbaric oxygen, chelating compounds, et cetera, end of quote. In other words, he did mention stem cells, peptides. I assume that he means exosomes and other things like that. So that would be a huge shift if the FDA actually approves that. So we shall see if it actually occurs or not.
Yeah, I think it'll be interesting to see. I mean, we all know there are some basic things that are not happening in this country in terms of like what the quality of our food, some things that are additives here that aren't allowed in other countries that we know are harmful. And then some of the things that are allowed, sometimes you like wonder how that got approval. And of course, each country, each system is different, but I think it's something that we can certainly improve on as a nation. So that will be interesting to watch.
Yeah. And since he's, registered Democrat / now he's working with Donald Trump, I don't think it's too controversial in terms of politics or hurting people's feelings. We will see if he can actually open up stem cell technology to help combat disease.
Yeah, it's like we know they're incredibly powerful, those stem cells. So if they can be harnessed for good, that would be very exciting and a next frontier in medicine for sure. So we'll see if scientists are allowed to do more research. Who knows what could come next. Any other takeaways from this sounds like a great experience.
Yeah, no other takeaways. It was held in New Orleans, Louisiana. So the weekend right before Halloween, as well as the weekend of 3 Taylor Swift concerts. So it was a bit crowded, very crowded. But other than that, the meeting was great. I learned a lot, and it was really a lot of fun to go to my very first facial plastic surgery meeting.
That's amazing. Well, I feel like inspired maybe to go to one myself. Thank you so much for sharing your insights. I know I learned a lot from this, and I'm sure our listeners did too. If you have questions about any of these topics and want to deep dive into them, please comment below and we'll do an episode dedicated to that. And as always, to our listeners and Dr. Kim, stay beautiful.
Stay beautiful.
Thank you for joining us on The Beauty Scientists. Be sure to visit thebeautyscientists.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.